COVID-19 is taxing our region's hospitals. In Southwest Ohio, 179 COVID patients are currently in the ICU. And of the total ICU patients in our area, 33% have COVID-19.
The Health Collaborative says facilities are functioning at capacity. Now that means every bed is utilized with fluctuations based on staffing and daily demands.
With COVID cases putting pressure on the system, ERs around the region are alternatingly bypassing some patients, not the most pressing cases, but some, to relieve a little of the strain. That's how serious this is, and that's why it's important to talk about how COVID cases affect the big picture. Thanks to St. Elizabeth Edgewood, we got a closer look behind the front lines. Unless you need hospital care, setting foot inside a place like St. E's Edgewood is tough because of COVID. The onset of the highly contagious Omicron variant means strict visitor restrictions are back. So to get inside,
we've gotten additional crash carts.
And bring you the story of the frontliner fight in this corner of northern Kentucky, we relied on Zoom and the smartphone of nurse manager Melissa Schumacher.
Tell me where you are at the hospital right now.
Overwhelmed, frustrated and sad, and concerned that we're not going to be able to care for everybody. We're at capacities all across the system.
Melissa told us the pulmonary unit has 32 rooms and 32 COVID patients right now. The sickest of the sick end up in the ICU there. As of Thursday, system-wide, meaning the campuses at Edgewood, Fort Thomas, Florence, and Dearborn, 207 people were getting COVID care. That was just shy of the all-time high last January. 18 of those coronavirus patients were on ventilators.
When you say you're sending people over to the ICU, about how many people are going to the ICU every day?
It varies, but more than we ever saw before. We've actually had to open an additional ICU recently.
As of our interview, St. Elizabeth said 86% of the 28 COVID patients in intensive care units were unvaccinated, and 89% of ventilator patients had not gotten their shots. We also talked about the vaccination rate on Melissa's 3C.
Today, we have, like I said, 31% of our population on our floor of our 32 patients have had the vaccine. That's 10 people of 32.
And are they doing better than the non-vaccinated?
Yes.
They are. Okay.
They're either on less O2 or no O2, requiring symptom management, but they're not as critical.
Still, all require considerable care. You see medical staff suiting up for every room encounter. That's lots of masks, gloves, and gowns. Melissa tells us they restock 3 to 4 times a day to keep up as they help their patients who are trending a little younger from last year. She says 3C's most common COVID patient age ranges from 40 to 60 now.
It's hard. I did not think we would be here in 2022.
And actually, folks in hospital systems across the region have told me that. Today, I spoke with the medical director of Hamilton County Public Health. He says as we transition between variants from Delta to Omicron, we're getting more hospitalizations. There are people getting it and giving it, and the vaccine prevents most breakthroughs, but not all. Dr. Steve Fagans told me Omicron is less severe than Delta, but way more contagious. And what's spreading is about equivalent to what originated in Wuhan back in 2019. So less fierce, but certainly not without teeth.